Hey everyone, welcome to this explainer. If you're a clinician in training, look, you already know that memorizing the clinical steps of a head-to-toe exam, it's a massive undertaking. I mean, it's huge. But knowing exactly where to place your stethoscope, well, that's really only half the battle, right? So today, we're going to treat this explainer like an actual clinical shadowing experience. We are zooming out. We're going to look way beyond just the clinical maneuvers themselves and focus entirely on mastering your bedside manner. We'll be breaking down exactly how to keep your patients comfortable, informed, and, above all, respected throughout the entire process. Let's get right into it.
Okay, let's dive into this. Consider this agenda our clinical rounding schedule for the day. We're kicking things off with mastering the exam flow, then moving right into setting a comfortable stage. After that, we'll cover narrating the physical exam, prioritizing patient comfort, and finally, adapting for limited mobility.
Starting off with Section 1, Mastering the Exam Flow. Before you even walk through that clinic door, you've got to have a game plan. So I want to pose this question directly to you. How do you perform a really thorough exam without treating the patient like they're just a checklist? It is incredibly easy, especially when you're first learning the ropes, to get so laser-focused on completing every single systemic step that you kind of forget there's a vulnerable human being sitting right in front of you. There's this constant push and pull, a real tension, between your need for clinical thoroughness and the patient's absolute need for dignity.
Well, the answer to that tension lies in what we call continuous flow. Basically, this means combining different system exams into one smooth, unified sequence. Think about it. Instead of checking the entire cardiovascular system, then making the patient sit up, then lie down, and then stand all the way up to check the pulmonary system, you integrate them. You blend it all together. Efficiency here isn't just about saving you, the doctor, a few minutes. Minimizing the number of times a patient actually has to physically shift positions is absolutely paramount for their comfort. It's a unified sequence where literally everything you need to do while the patient is sitting happens all at once.
But here is the absolutely crucial part. Your flow has got to remain highly flexible. A rigid, standard flow? That's fantastic for a perfectly healthy patient coming in for a routine general screening. But in the real world, the exam must adapt to the patient, absolutely not the other way around. Say a patient comes in with a specific localized complaint. You alter the flow to spend way more time right there. Or if you're working with an older patient who has some mobility issues or maybe a really scared little kid, you have to adapt your sequence to suit their specific needs in that exact moment. You gotta read the room.
Moving right along to Section 2, Setting a Comfortable Stage.
Okay, let's virtually transition right into the exam room and shadow Dr. Christine Kaufman as she meets her patient, Rachel. Now, what's really interesting about this is the very first thing Dr. Kaufman does. Right after introducing herself, she asks, "Did you have any difficulty finding your way here today? No parking issues or anything like that?" Think about that for a second. She hasn't even washed her hands yet. She intentionally pauses to build instant rapport. She's actively bringing the tension down in the room by acknowledging the patient's real-world, everyday experience before ever shifting into clinical mode.
And notice how this naturally builds into the physical staging of the room. When she's setting up to take vitals, Dr. Kaufman doesn't just leave the patient awkwardly dangling her legs off the edge of the crinkly paper exam table. No, she moves Rachel to a regular chair, makes sure her feet are completely flat on the ground, and specifically pulls out an armrest so she can fully relax her arm. Then, after verifying her name and date of birth, Rachel Green, October 2nd, 1975, she explicitly tells the patient out loud that she is going to wash her hands before any physical contact. This kind of intentional staging ensures maximum patient relaxation. And, fun fact, that actually guarantees much more accurate vital signs. It's a total win-win.
All right, Section 3, Narrating the Physical Exam.
As we get into the actual core of the physical exam, I want you to focus really heavily on Dr. Kaufman's communication style, and specifically the why behind it. The core purpose of your exam communication is basically twofold. First, you have to let the patient know exactly what is going to happen next, so their body is never startled by a sudden, unexpected touch or movement. Second, you need to explain your findings in real time. I mean, let's be honest, sitting in a sterile exam room wearing a flimsy paper gown is incredibly anxiety-inducing. Narrating your actions step by step,
It completely removes that terrifying fear of the unknown. Here's a perfect example. During the scalp examination, Dr. Kaufman tells her, "I'm going to have to move your hair a little bit so I can get a look at your scalp. I'll try not to mess up your hair." Honestly, this is brilliant. It's such a simple, everyday phrase, but it demonstrates profound respect for the patient's personal space and, their daily life outside of the clinic walls. It simply acknowledges the patient as a person first.
And as she progresses, watch just how seamlessly she weaves her clinical findings right into normal, casual conversation. Right after taking vitals, she immediately tells Rachel, "Your heart rate is 68, respiration's 12, blood pressure 118/72. When she's looking in the ears, she casually mentions, "Oh, there's a reasonable amount of earwax," pointing out that it's totally normal, and even noting out loud that she couldn't see one eardrum clearly. During the general skin inspection, she reassures Rachel that she sees no bruising or sores. Do you see what's happening here? The patient is never sitting there holding their breath wondering, "Uh-oh, what did the doctor just find?" The information is shared immediately and transparently.
Moving right along to Section 4, prioritizing patient comfort.
Now, parts of the exam, like listening to the heart and lungs or examining the abdomen, they require exposing parts of the body. Maintaining modesty during these moments is absolutely non-negotiable. Notice Dr. Kaufman's precise wording here during the lung exam. She says, "I'm going to lift up your sports bra a little bit, is that okay? I'm going to return it to where it was." She is constantly asking for permission. Whether she's moving a sports bra, pulling the neck of a gown forward to check the collarbones, or asking the patient to lower their shorts down to the hip bone for an abdominal check, she is actively empowering the patient. Just by asking, "Is that okay?" she gives the patient absolute agency over their own body. And beyond just modesty, prioritizing comfort means continuously checking in. Dr. Kaufman constantly asks, "Any pain or discomfort?" while she's palpating the head, the neck glands, the abdomen. And this brilliantly illustrates how to handle mistakes too, because they happen. At one point, her blood pressure cuff actually has a leak. Now, instead of silently looking confused or frustrated, which, let's face it, would absolutely terrify a patient, she calmly explains the minor hiccup out loud, apologizes, and simply repumps it. Maintaining a steady, calm, empathetic tone during technical difficulties goes a long, long way in preserving trust.
Finally, we've got Section 5, adapting for limited mobility.
The physical exam environment simply has to adapt to the patient, especially for folks who might have limited mobility or a different body type. You do not have to force a patient to sit perfectly upright on the very edge of the bed if they physically can't do it. There are so many workarounds. You can prop yourself up on the side of the bed to get behind them, or just stand right next to the bed and lean over. If the bed allows for it, just have the patient gently swing their legs to the side so you can stand directly behind them. And hey, don't forget your own ergonomics here. If you need better access, grab a footstool to raise your own height. Or, if you're lucky enough to be in a hospital room, use the electronic controls to just lower the bed down to you. The absolute golden rule here is this: manipulate the physical environment around the patient. Never, ever force the patient into uncomfortable physical positions.
Which really brings us to our final overarching thought for the day. Ultimately, does your physical exam treat just a biological body, or does it treat the whole person? By utilizing continuous flow, building immediate rapport, narrating your steps out loud to eliminate fear, prioritizing modesty, and fully adapting your environment, you do so much more than just check off boxes on a clinical rubric. You treat the human being in front of you. So I really want to challenge you. Apply these patient-centered soft skills in your very next clinical rotation. Try it out and just watch how it completely transforms the level of trust your patients place in you. Thanks so much for joining me on this explainer, and I'll catch you next time.